Start.
So coming to rituximab molecule, this is basically an anti-B cell therapy, by which we mean the B cells which have the CD20 cytokine over them, they are blocked by this molecule. And as I have already told you, that the B cells number, the population of B cells increases in rheumatoid arthritis. So we, after attacking those B cells, we can reduce those B cells, and we have seen spectacular results in rheumatoid arthritis. The same thing we extrapolated to other rheumatic diseases like lupus, then ANCA-associated vasculitis, and many other rheumatological diseases where we are using it nowadays. And coming to this anti-CD20 molecule, that is rituximab, Dr. Reddy's I had already told you that Dr. Reddy's had developed a biosimilar molecule way back in 2009, and we have started using that. My experience with this agent, particularly rituximab biosimilar, is spectacular and fantastic actually, because most of the patients, over a period of 10 years that I have, 9 years that I have been using, most of the patients we could resolve the symptoms and signs of rheumatoid arthritis, and these patients were already taking the conventional medications for a long time before I started them on rituximab. So FDA has approved this particular molecule for when the patient fails methotrexate. So we need to add this biologic agent along with methotrexate, and that's the best one, because the result shows that that's the best one. Though we can use it as monotherapy also, or definitely in patients who have failed the TNF alpha blockers, there also we can use it. And coming to my experience about the rituximab biosimilar molecule of Dr. Reddy's, which I have been using, I think it's fantastic molecule and giving very good results. And the cost factor is it's quite cheap, and it is given in only 2 weeks. We give it over a period of 2 weeks, 1 gram now and 1 gram after 2 weeks. Most of the patients, they show improvement with the first induction doses, and they don't require any booster doses, which may be required in few cases. I must have given not less than 130 patients in last 9 years time, and I have seen very good results, which we cannot probably extrapolate to the TNF alpha blocking molecules also. And apart from being inexpensive molecule, hardly I have seen any side effects or any adverse reactions with this molecule. Most of the patients have responded very well. Coming to my patient of a case of ANCA-associated vasculitis, that is granulomatosis with polyangiitis, I have treated this patient over a period of 5 years with 10 infusions of rituximab biosimilar. And this patient, to start with, she came with breathlessness and chest pain and arthritis, and at the same time she was actually found to have a lung mass, a mass in the right side of the lung. And everybody thought of cancer, though it turned out to be, as I told you, ANCA-associated vasculitis, that is Wegener's granulomatosis. And initially I tried with the cyclophosphamide and steroids, but it failed. And when she developed retrobulbar neuritis, I decided to switch over in 2010 to rituximab. At that time, few case reports of rituximab in ANCA-associated vasculitis was available. Though I had pinched my hope on that, and I started on that molecule, and after giving the 2 induction doses, she did fairly well, and her ESR and the other acute phase reactants went down, and her breathlessness also improved. But she kept telling me about breathlessness maybe around 4 or 5 months from the first induction doses. along with a recurrence of relapse of the joint pains. When I started giving her the first booster dose and followed by next another 7 booster doses. So total I had given 10 doses of rituximab biosimilar. And over a period of 10 years I have seen fantastic result, because the patient has improved a lot. And in my last in her last visit in 2016, she has improved a lot, and almost she is coming for a 6 monthly follow up now. I have stopped giving rituximab. She is only on a very low dose, that is 2.5 milligram of prednisolone. She did fantastic with this molecule. And so I can tell you that from my experience of around 9 years, rituximab biosimilar has developed by Dr. Reddy's is fantastic and doing very good. As far as the side effects are concerned, I have hardly seen any infections, even in this patient which I have described right now. Though the side effects of infections are seen in theory as well as in practical in many setups. So we need to be aware of that, because as the B cell goes down, sometimes you may be prone to develop certain infections in your body. So the precautionary part which I would like to highlight is the patient should not go out into crowded places whenever they take this biologic therapy, whether it is anti-B cell therapy or anything else. Okay. So further to add about the this rituximab molecule is, it can even be given in patients who are suffering from rheumatoid arthritis and tuberculosis. And with some caution, it can be given in patients of rheumatoid arthritis with interstitial lung disease, where in both these conditions, as we all know, the TNF alpha blockers are not the drug of choice and should not be given. To conclude, rheumatoid arthritis patients are at an increased risk of developing deformities over a period of long time. So in order to reduce these disabilities and complications, we need to focus on the treatment of rheumatoid arthritis, both conventional and whenever the biologics are required, we need to consider a good molecule to counteract this disease. And rituximab is a very good molecule, as I have an experience of around last 12 years that I have been giving this molecule over, as I have already told, 130 to 140 patients that I have given over a period of time, and I have not seen any major or hardly any minor complications with this molecule. Thank you.